slide. So at the same time, you don't want it to be too dry, otherwise you'll cause a certain amount of friction. And almost with that friction, you start working more with fascia than muscles, which is another whole other area. Obviously today we're using oil. I use wax. It's a personal preference, so massage wax. It's been a long time since I've used oil, so we'll see how it goes. So we could start with a hold, but as it's only a demo, so I'll just go and do that. And then also for me personally, I like, if you just pop your arms there, I personally like the client's arms to be there. If they get uncomfortable, they could put their arms down, but for me it works really well, especially for the techniques that I'm going to show you shortly. So let me start with some nice deep massage. My bump starts to get in the way. And I might come to the side. So that thing of sinking, it's literally, my arm is there, I'm relaxed. This is almost like a horse stance here, so slightly different to what we were talking about before. But my back is strong, I'm comfortable. I can stay here all day. I can lean in a bit more if I want. Is that okay? And I'm just going to move slowly. Now you could put your arm here, but at the beginning, if you put your arm here, you tend to tense a lot. So I don't really need it for this. So this arm is nice and relaxed. And just move down, nice and slowly. Now draw likes his little movements like that, which you could do, or you can just step. And as we come down, what I'm going to do here is just use my elbow a little bit to create a mini stretch. Can you feel that? Yeah. So just around the top of the iliac crest, taking a little stretch. I might come back up. Very simple. Forearm movements here. So I'm getting the QL a little bit, edge of the erectors. I'm just trying to show you how I might sort of put it together. So you can see it's quite fluid. I might then come up this way. But I'm nice and relaxed. And again, my light is pointing this way. I work very slowly. I might come this way. So again, I sink and I wait. And her tissues go, and I go, so I know I'm relaxed, she's relaxed as much as possible. And then we go in. So you might apply this pressure here. You might, as George said, you might turn your arm this way. Might be better for you, using the back of the arm, or you might come this way. But in any massage, you could incorporate all of this, just testing it. If you're going slowly and you're going at a nice pressure, the client won't know that you're testing it. It's because it'll all connect together, as long as you move. So I might come up this way. I might come across now. Maybe I'll come across this way. And I'm just, literally, we could stay here for a couple of hours. You might fall asleep. So again, I might use that horse stance, and especially at the moment, because it is easier for me. But I can go this way if I want. And then that movement from before. So it's like a very deep effleurage almost. Nice and slow. Just warming it up. So I use a lot of this at the start of my treatment, because I'm working very slowly, and I can work slightly more superficially, and it is an effleurage, but I'm not having to do very much. Did you want me to incorporate some glute work, or?
After.
So the main things we were talking about was that sinking in, so really just waiting, so wherever you are, even at the start, even on this effleurage I did, I'm still sinking in. And it just lets me go forward. It naturally wants to go that way. So whether that's like with your hands, or whether that's even this way, let's sink. Make sure that you are relaxed, your arms are relaxed, which helps them. And the other point, what is another point that people are struggling with? We said we'd show. So further different movement.
Yeah, for me, coming sideways like this was hurt the bone a bit. And then trying this way, I felt like I was moving unnaturally.
Yeah, so again, you'll find your way, so it might be this way. But again, sometimes it might have been the angle.
Yeah, I was coming from the...
So if I'm coming this way, I am going to use the ulnar here in my elbow a little bit. So if I want to work a bit deeper, so after I've done all that type of work, I might come here, I might rest here, might create a little stretch, but usually from about here. But it feels different now.
Yeah.
You feel the difference? Yeah. And I can apply more pressure if I want. I can use this arm. I just don't tend to, because if I do that, I tend to do that. And now the muscle is tight and it feels different for her. And I can't sink in the same way.
Yeah.
So I just tend to use my body and relax. And there's pressure there, isn't there? You can feel it. But I'm not, it's not tiring me out. Whereas if I do that, then that would tire me out. And that would hurt my elbow.
Yeah.
So I spoke to you about elbows. That tension, I can immediately feel it in my elbow. Whereas when I relax, it's just nice.
So
just like it.
Can you cut round the scapula? I mean,
there's different ways you could do it. Yeah, you could come up this way. You might move your arm around the shape.
That's how that was the most comfortable way for me, lengthwise.
Yeah, you might try that. You might come back this way, you might come this way. But it's as your arm and your elbow, sort of its listening touch develops. In the beginning, we're just used to it being our hands. It takes a little bit of time to be able to feel it in the same way in your elbow that you can, touch with your hand. Oh, there, I feel tension. It takes a little while for the elbow and the forearm to get that sensitivity.
Sorry, you said you used a deep effleurage.
Ways you could do this. So you might start your treatment, with a hold. Obviously, we'll be doing a normal massage, so you wouldn't have a top on. It's just for this demo. So you might start with a hold. You might have already worked on the back and then decide to work on the glutes. You might, after you've done your hold, you may have started your treatment and worked on the legs, covered the legs up, and now you want to do some glute work. There's no right and wrong. There's, different ways. Maybe you might want to work in your mind that you're working from the feet all the way up, and maybe you finish on the back, then you turn them, work across the shoulders, or maybe you started with them face up. You've already done that. So there's no rules as to when to put it in. Again, we're going to do some forearm work with glutes, and it is all about that leaning that we talked about earlier, and even more so with this. So to start with, so my arm is floppy. If I'm like this, it's going to feel horrible, and it's horrible for me and for her. So I'm literally just going to feel the tissues, and I'm just going to sink in. There's no tension in my body. I can do it this way. I can do it this way. Depends on you. Some people will be really tight. For them, this is sufficient. But there's pressure there. You can feel it, can't you?
Yeah.
But again, it's a broad pressure because it is the forearm. My arm is relaxed.
Yes.
But I can get a lot of pressure in there, and it is all about this lean. So it's this leaning on the bar, this whole relaxed feeling.
Are you moving that arm?
No.
Have you had massage before? Just still pressure.
Yeah. And it's nice, isn't it? It's not.
It's sort of like compression with the forearm.
Yeah, but it's deep.
Yeah.
So obviously I haven't got any of glutes are not exposed. So I'm not warming the area like I might with effleurage. This is replacing what I might do with effleurage. So on some clients, I might do some work directly onto the glutes, and on other clients I would always work through the towels. It depends on them, depends on how much I'm going to incorporate that into the treatment. I'm only going to do a short period of time on it. And also, some clients might not want you to actually have skin on skin on their glute. It might be a bit too personal for them.
And is this something you could do without the... I have a couple of clients that really like their glutes worked, but not under the towel, not over it. So is this something you do on bare skin then?
You absolutely could, yeah. Okay. Yeah, so you could move your drape around. This towel's a bit small, I wouldn't use it this way. So you would sort of fold it over to create like an envelope. So like I said, that sort of work, and for some people that's enough. Now, I'm using my elbow a bit here, and I'm getting into like piriformis a little bit. Now, if I want to increase the pressure or I want to pinpoint an area, this is this listening thing I was talking about earlier about your forearm and about your elbows. So trying to make them as good as your hands so that you can really feel it. So I can feel at the moment where I've got my elbow, there's an area in this area that's going to be quite tight for her. So if I want to increase that, I move my elbow. Is that okay?
Yeah.
Not too sore?
No.
But you can feel it.
Yeah.
And it's deep.
Yeah.
And I could increase it. But do I look like I'm, you know, there isn't any tension. My bicep is loose, my triceps is loose. It's all in this lean. It's real, like lazy person's massage. It looks like I'm not doing anything and that she won't really get anything from it, but you are, aren't you? You can feel it.
Yeah. But it's it isn't like a piercing
No.
pressure.
And we can go deeper. And it's quite deep now, isn't it? You can feel that, the difference.
Yeah.
And I can work this whole area. But the way I work it is I kind of come off it and then sort of push back. And that's a little bit like that sinking that we talked about earlier. So yes, I'm sinking, and there is a pressure a little bit that way, which is quite nice because when I come to this side, I'm going to move this way, which just helps with that movement. So if I come around this side, so I can go this way. Can you see the body move? As you have one side that probably moves more than the other.
So it's literally that way, not that way.
Depends on what I'm feeling. So if I'm feeling an area where it's very, very tight, I might want to put it that way to stretch it slightly. But I usually start this way.
If a person says to you they've got lower backache, does that mean the glutes need to be looked at?
Depends on the client.
Yeah, it depends on the client. Personally, if someone came in with a lot of lower back pain, glutes and piriformis is an area that I would treat for sure. Along with sort of QL, probably a little bit of hamstrings, also hip flexors. But that's kind of another level. So if someone comes in, yes, treat lower back with the stuff that we've been doing today, you know, those movements, moving everything around, treating the erectors. But yeah, glute work is usually really beneficial for people. If I now go here, and now reduce it, this arm is relaxed. So it's a bit tighter on this side, isn't it?
Yeah.
Is that okay?
Yeah.
You feel it a bit more?
Yeah.
If we had to talk about pain on a scale of 1 to 10, what number would you say you're at?
Well, actually, it's only a 4 that I can feel that I'm really tense. It's not what you're doing, it's that my muscle is tense, so the pressure's good for it. If I feel...
Yeah, it's tighter, isn't it?
Yeah.
So it really, you know, it's a bit, like I say, it's like lazy person's massage. Like, what am I doing? Leaning. But it feels nice for her. Until you have it, you just think, well, what's all that about?
You know, people who sit on the desk all day long, is that a good technique to do on them?
Yeah, it's usually good for most people. So piriformis is an area, like say if you're driving a lot, if you're at computers a lot and you're in that position, usually piriformis gets quite tight, along with hip flexors. We're doing hip flexors today. So yeah, so we can work glutes, you know, we can work fists as well. But really for today, I just want you to think about that movement here, moving it around, very similar to when you're using your hands and you feel that point. Okay, there, she's got some area of tension. You okay?
Yeah.
The pain?
Yeah.
And reduce the area. There's a point just in there, isn't there?
Yeah, you're exactly on it.
Yeah.
It's quite weird to hear someone say just there when they're using their elbow rather than
That's what I'm saying. You build up that. In the beginning, it's a bit like, it's my elbow, you know? Like, how sensitive are we with our elbows? In the beginning, not really. But it comes.
So, hence I've got my little chart thing of I've mapped out literally from now to July.
So that's really some nice glute work that you can do without exerting hardly any energy yourself, but actually feels great for the client, doesn't it?
Yeah.
So you're kind of sort of working around this whole area here. You can work the whole glutes in that way, certainly with that forearm and with that elbow, but usually the elbow, when you reduce that, most people, it's sort of around here where they really feel it.
And with the oil, well, it would be the same technique.
Well, for that, I wasn't moving. So if I was doing skin on skin, I probably wouldn't really have any oil. I would only have the oil that was left over, maybe on my forearm from something else I'd been doing. If I decided to work deep into it, yeah, I might come from here a little bit. I might work this way. Might even be on this side.
It's really the response.
Might kind of work a little bit, even through the towel.
Right, okay. I've not had really any negative feedback. It's nice.
Again, so it's all very similar movements that we've done today. Again, you can go across here. So I can then move in that way. You feel a little bit of tension going on in that area there. Okay.
So that was after this.
Reduce the angle.
After that, how I can do it. That's absolutely brilliant. And I wrote that and like.
And work in that way. So yeah, you could have a little bit of oil in here, but you don't really need very much because you've probably got some there. And even through the towel, I could slide quite easily. So, any more questions about that? I think George was talking something about.